Hey, Dr. Lindsey and Wendy here. Hey, this is a quick 2-year update on a medical professional who had class 5 plus, maybe even class 6 hair loss that we've done 2 strip cases on, and he is blessed with a low color mismatch between his light hair and light skin, but cursed with very fine hairs and a relatively limited donor area. So here he is when we first met him, and remember, he's a medical professional, and we essentially drew a mature hairline on him, and here he is at the end of the case. You've got those hairs in there pretty well. Good, yeah. And he was a good fella. He cleaned, unlike most doctors, he followed instructions and cleaned well. Although he's nearby, I think we didn't see him for about a year, and then here he is at a year, and that front's done. You know, even though he's got fine hair, that's done. So his second case, I think we put a couple hundred singles right along his hairline. He parts his hair towards the right. And then we started behind his first case and worked to the crown. And he walked in today, 2 years and 3 days out from coming here the first time, and he did this little video testimonial. So take a look. So Steve, you're now 2 years out from me working on you.
Yep.
And you're a medical professional with fine hair and really fair skin. And I'll put your before pictures up on the side of this thing. Wendy, comb his hair just a little bit, would you? The front.
No, yeah. So we did from here down.
Yeah, down the middle. And so tell me, you were saying that you were happy with things, yeah?
Yeah, everything's been great. The first transplant's basically fully done now, and you can barely tell it was there, and the second one's still growing in, but it's looking good.
And families, friends, anybody comment too?
I mean, my wife is really, really happy. She can't tell at all that it was done, and I don't think any of my friends, unless they're really close, even know anything happened.
And how about your mother?
She doesn't even know. No,
great.
My parents don't know.
That's perfect. Because I saw 2 guys this morning that were hair transplant disasters from elsewhere, and all they wanted was to look like they had had a hair transplant.
Yeah.
And unfortunately, it's too late.
And this looks very natural. Like looking at you, there's no way anybody would say, "What did you? You had a hair transplant. It looks good."
All right, spin around. Let me see the back of that head there one time. Show me that scar, Wendy. And what number cut is that? Do you know? Wendy, what's that, like a 3?
That's like a 2. That's almost a 3.
And so that's twice in his head, 2 strip cases, and that's the little scar. That's a pretty typical Lindsey scar. 8 of them a year are better than that, and 4 of them a year are worse, but that's pretty typical. Anything you think people looking at this ought to know?
Yeah, just if you're thinking about it, just do your research, make sure you're ready for it. But I've been really happy with the result, and it's a process, so you got to be patient. But the results are good at the end.
All right, thanks, man. So what do you think, Wendy? I wanted him to show his face because he
does look really, really good. As you look at it and you're like, oh, that looks thin. But it looks so natural.
He went from looking like a young bald guy to looking like an unremarkable guy that she would pass at the grocery store and not even
think that he had something done or anything like that. Yeah. He looks really good, and it's I like those kind of cases because you tend to be a little, you are too straightforward, and then you try to minimize the people's expectations on things. And for him, I mean, really, like he went from bald, because he only had that little thing here, to having hair and looking good, even with thin hair.
And his wife's happy.
Yeah,
and his mother never knew.
No.
And like all these guys, I mean, he looks fine the way he is. As he walks out the door, he starts asking about a 3rd case. And I said, let's just chill out for a while. We'll see. We just signed another lease for 5 years, so we'll be here at least another 5 years and maybe a couple years after that. So, all right. If we can help you, give us a call. Thanks.